Welcome to Difference Makers. My name is Darek. I'm President and CEO of Velocity. We are an IT service provider focused on IT leadership. In these times, we're also focused on community leadership. Who's making a difference right now? And today, I'm excited to have Arun Singh from Cream Ridge, New Jersey. And I first want to start and thank him because I know he's on the front lines today, dealing with this thing front and center. And I just want to say thank you, and I think speak for everybody to say thank you. So, Arun, do you want to introduce yourself and tell us what you do?
Sure. My name's Arun Singh. I'm 52 years old, board certified in emergency medicine, been practicing now for close to 22 years. I live in New Jersey.
So what's the reality of what's going on right now?
Reality is it's, for me and for everybody I work with, it's scary, you know. I work in the, like I said, I work in the emergency room, been doing it for 22 years. This is the first time I tell people that I can remember. I mean, we've been through HIV, SARS, MERS, all these different communicable diseases. This is the first time I can remember where everybody who works in the ER, everybody's afraid to go to work. You're driving in, you're fearful. And this has happened to me personally before. You get afraid of certain things. It's transient, it comes and goes. But this time, every time you go in, you have that fear that, am I going to catch it? And you still go to work. We still do it. The thing is, what I've learned, from talking to other people is, you can't let the fear paralyze you, because if you get paralyzed, then it's all over. And we sort of, people keep saying it's like a war and stuff. I mean, never been in the military. I have no idea, but it's our job. This is what we, are trained to do, whether we're physicians, nurses, respiratory techs, transporters, housekeeping. We go in, and everybody on the front line, you go in, but this is the first time I can, honestly say that everybody is afraid. And I think fear is a good thing, because, for us, it makes us, be on our guard all the time. And that's the other thing, especially nowadays when going to work, is it's very mentally draining.
How are you taking what you're dealing with every day and being able to take some of that information or some of that stress and take it out and try to help in your community? Are you able to take information and give it to people, or how do you manage that?
We working on the front lines, we have a unique perspective. We see this in reality. Most people who are not in the front lines, they're getting desensitized almost, with the 24 hours a day of watching the news on social media. Okay. After a while, numbers sort of lose their meaning. Like today we see 18,000 people died in the United States. You got to realize 18,000 people died. That's affecting families. It's affecting everybody. And that's not just people who are critically ill. And what I tried to do, because of the platform that I've been given, and I think a lot of healthcare workers, regardless of what they do, who are on the front lines, is try to stress to people I know, friends I know, family, is you have to take this seriously. Because I tell them, I go, I'll give you an example. When this first thing started, my first reaction was, I hope I get it. Let's get it over with. It'll be mild. It'll be a cough, cold, and that'll be the end of it, and I can get on with my life. Now that I actually see the reality of it, I'm scared to death to get it, because it is, 80%, 85% of the people get it. It's very mild, very minor. Some people don't even know they have it. But if you get if you're unfortunate to get the severe part of it, it is not a good thing. And that, and you're talking about 10, 15, 5%, but you don't want to be in that 5%.
Yeah.
I don't want to be in that 5%. I don't want anybody I know to be in that 5%. So when I go around, I tell people, I warn them, I say, listen, you have to take this seriously. It's not a joke. When you go out, put a mask on, wipe everything down.
It's interesting, because I hadn't really thought about that, but the fact that the people I know, so you know, my wife is an MD and she doesn't practice, but she has friends who do. And I've talked to a few of her friends, and I come away feeling much different when I talk to them and I would listen to what they're dealing with than when I just talk to somebody who's reading data off a website and
Right.
saying, well, those are the statistics and things like that. And one of her friends is a emergency room doc up in Toronto, and she is very similar to what you're saying, is that people don't realize what happens if you're one of the 15% or 10% or whatever it is that really gets, they don't realize what it is. And so keeping it front of mind and making sure people know, I really appreciate it. And I appreciate the fact that you mentioned earlier that even in the grocery store, you'll tell people, put the mask on, that kind of things. I mean, I think it's important for people to know that someone from the front lines is saying, hey, it's real. It's not just some statistic somewhere. So I really appreciate everything you do. And anything else you want to tell anybody?
No, just, and one thing I, is always try to find a silver lining in everything is, pollution's coming down, more time with the family, which is, whether it's good or not, but, it really makes you appreciate what you have. The kids are doing food drives, trying to, I think, I'm trying to be more part of the community, helping, because you really appreciate how fortunate we are in the world. And, maybe it's part of just getting older, but, it's time to give back, help your less fortunate, people in society, I mean, the fact that we can do this, if we all gave back a little bit, it would make a huge difference. I mean, 16 million people just lost their jobs in the last 3 weeks.
Yeah.
So it's, that's the other thing I try to stress. And I want to do it for myself first, because I cannot ask somebody to do something I'm not willing to do myself. So I think, it's just part of it is the same thing. It's just looking out for the fellow, man and woman, and just helping.
Agreed. Well, thanks a lot for the time. And again, I appreciate it. And I say it for everybody, I think, thank you for the work you're doing.
Thank you. Take care.